Good morning. In this video, I'm going to be demonstrating some exercises from a specific post-surgical total knee replacement rehab program. The program is a PDF file. I'm showing you how the exercises look in real life. So the first exercise I'm going to demonstrate is called an ankle pump. Now this can be done laying flat or it can be done laying on an incline. Usually it's done in bed. And if I'm laying back in my bed, we're pretending that it's a left total knee replacement. What I'm going to be doing is pulling my toes back and pointing my toes forward. Now, I'm going to remove my shoe so I can demonstrate a little better. You can see I pull my toes back, I flex the ankle, then I extend the ankle by pointing my toes down. The intent of performing this exercise is to help pump some of the fluid out of the lower leg. Assuming there's going to be some swelling on the knee when you're up on your feet or in a seated position, that fluid is going to drain down into the foot and ankle. This is one way to start to move that fluid, support the lymphatic system, and get that fluid back into circulation. A better way to do an ankle pump is to elevate the leg. So in some cases, what we would do is we would arrange pillows on the bed so that the leg is higher. If you can imagine, I'm laying in bed just like this, and now I'm going to perform the same ankle pump exercise but with the leg elevated to between 30 and 45 degrees. I'll perform 20 to 30 repetitions 3 to 4 times a day. The second exercise in the series is called a quad set or quadriceps set. So this muscle of the upper thigh is called the quadriceps muscle. It's made up of 4 separate muscles. And when you're doing a set exercise, what you're doing is you're tightening the quadricep and then relaxing. There's a little bit of movement because when the muscle contracts to tighten, it shrinks together and becomes firm. Then when you relax, the muscle becomes soft. Now, a lot of my patients after a knee replacement, especially if they've used a tourniquet during the procedure, will have a lot of thigh pain. They'll have a lot of weakness in this muscle. They won't be able to lift the leg because that muscle is impaired from the tourniquet damage. That's okay, that's common. What you're gonna do though is you're gonna work on tightening the muscle and relaxing. One of the main mistakes that happens is patients think, well, if I'm gonna tighten that muscle, that means I have to lift the leg. If you find that you have a tendency to do that, you can place a pillow underneath the knee. And then what I'm doing is I'm tightening the muscle and I'm pushing down into the pillow. Pushing down into the pillow will tighten the glute and the hamstring as well, but it's one way to activate the quad muscle without thinking of flexing the hip. So again, quad sets, you would typically do this 20 to 30 times. You would repeat it 3 to 4 times in a day. The next exercise in the series is called glute sets. Now, glute sets could be done seated, they could be done laying flat, they could be done in just about any position. But just like the quadricep, the glutes are the muscles behind the hips. When you squeeze them together, when you clench those muscles together, there's going to be a little bit of movement. They're going to become tight and firm, and then you relax. That's called glute setting. You would repeat that 20 to 30 times. You would do this 3 to 4 times in a day. The next exercise in the series is hip abduction and adduction, abduction and adduction. So the way they show it in the picture is they put a pillow between the knees. Your toes are going to be pointed straight up the best you can. And then what you're going to do is you're going to slide the leg out to the side and then you're going to bring it back into the midline. In this case, I'm going to scoot over so I have a little more room. Again, my toe is pointed straight up. I'm sliding out and I'm bringing it back together. I find that this is challenging on a bed or even on a couch or the floor just because of the friction and the difficulty with moving the leg. So a lot of times what we'll do is we'll just have our client roll to the side. So if my left total knee replacement is on the bottom in this case, I'll do an abduction of the top leg so that I can see what the non-surgical leg is doing. Once I've done a set of 10, I can switch and I'll do the same thing now with the surgical leg on top. We would do 10 repetitions. If for some reason you're not allowed to lay on your side, possibly you have a hip replacement or some other pathology going on, you just find a different way to do it. I personally, as a physical therapist, prefer to do these exercises standing. So if I was gonna stand, I would stand straight, hands on a kitchen counter, and I would raise my leg out to the side. 10 repetitions, 3 to 4 sets, once or twice a day. Probably one of the most common exercises following a total knee replacement is called a heel slide. It can be done assisted or unassisted, but basically what we're gonna do, this is the side that we're assuming was replaced. I would flex the knee and slide my heel toward my bottom, and then I would slide it back down. Yes, we're bending and extending the knee with this exercise. The friction of the foot on the bed or whatever surface you're on is going to provide some resistance. If I have the ability to lift the leg and I don't have the ability to work against the friction, what I could do is I could lift from the hip. I could bend the knee in as far as the incision and the post-surgical wound will allow, and then I would lift and put it back down. So it's an up and in, up and out. But the way the exercise is traditionally taught is to slide in, slide out. You can use your hands to assist. Sometimes this might make it a little bit easier. You could use a strap around the foot to help pull it into this knee flex position. This would be repeated 20 repetitions, 3 to 4 times a day. The next exercise in the series is called a short arc quad. And typically what you would do is you would place something, a folded up pillow, a towel roll, something under the upper thigh so that the knee has a little bit of support and it's elevated from the surface you're on. So you can see here I'm about 6 inches up from the top of the plinth, the mat that I'm laying on. And to do the short arc quad, what I do is, again, just like we did with the quad sets, I push down, I tighten the quadricep muscle, but this time because my thigh is elevated, what happens is my foot will actually lift just a couple inches. What patients tend to get wrong with this exercise is they try to do a straight leg raise, which is a different exercise. What we're trying to do here is tighten the quadricep, tighten the glute, push down into an object so that the foot comes up just a couple inches off the surface. We would repeat this 20 to 30 times, 3 to 4 times a day. Now the next exercise is a straight leg raise. And so when I'm doing this, the first thing that I'm trying to do is tighten the quad, tighten the glute so that the leg is as straight as it will allow. From here, I'm lifting the leg 12 to 16 inches off the surface and then letting it come back down. A couple ways that you could work with this. If there's been a tourniquet used, oftentimes there's going to be some thigh weakness, quadricep inhibition. What I can do is I can bend my non-surgical side. And what I'm thinking is I'm pushing my non-surgical side down as I lift my surgical side. So I tighten my right glute, my right hamstring, I'm pushing down into the table. And as a result, the left surgical side will start to rise. I would repeat this 20 to 30 times, 3 to 4 times a day. Earlier in the demonstrations, we did what was called a short arc quad. That's where I was sitting on the treatment plinth. I had a folded pillow underneath of my knee. I would push my knee down and tighten the thigh so that my leg would lift, my heel would come 5 to 6 inches off the mat. Now we're doing what's called a long arc quad. Very similar, but now I'm sitting in a chair. I tighten my glute, I tighten my quadricep, I push down, and as I push down into the seat, my leg will naturally extend and my heel will come up off the ground. I'll repeat this exercise 20 to 30 times, 3 to 4 times a day. The intent is not to lift the leg, it's not a straight leg raise, it's called a long arc quad. Earlier in the demonstration, we did what's called a heel slide. We did it on treatment plinth. I talked about sliding the heel back, pushing the foot forward. We're gonna do a very similar exercise, but now we're doing it sitting in a chair. So if this was the surgical knee, all I'm doing is I'm trying to keep the foot flat. I'm gonna slide the foot back as far as the wound and the incision will allow. Hold that position. You should feel the muscle underneath the thigh working. That's your hamstring muscle. The hamstring muscle is the primary muscle that pulls the foot back, and then you relax and let the foot slide forward. If you find that you're trying to do this and maybe you're hitting the edge of the couch, What you can do is you can slide to the front edge of the seat. You can pull it back so now there's nothing blocking your progress. If you find that you want to go a little further, but this muscle just isn't doing the job, you can use your non-surgical leg in front of your surgical leg, and both of them can pull back together to get a little more movement, and then you relax. This is something you would do 20 to 30 repetitions, 3 or 4 times a day. The next exercise in this series is a simple heel raise. So I would stand behind the chair or some stable surface. If you feel that you have to lean on something, you might use the walker in front of you, but the objective is to try not to lean on anything in front of you, just touch it for balance. If you watch my feet, all I'm doing is I'm going up on my toes, I'm lifting my heels off the ground, and then I control the descent. One of the mistakes that patients tend to make is they lift their heels beautifully and then they drop themselves down real quick. We want to control that descent. Up is just as important as going down. We want to absorb the impact. We want to absorb the shock. Now, what's nice about this exercise is I could do both feet at the same time. I could lift one foot and I can do one foot at a time. I can also do this in different positions. I'll move the chair so you can see a little better. If I was walking, when my surgical foot is in front, I could be in this position. I could still have the walker to support me, and I can do my heel raises with my surgical leg in front. I can also do my heel raises with my surgical leg behind. And this is the beginning of improving and normalizing your gait pattern, your walking pattern, so that you can get back to walking normally once you've recovered from the once you've recovered from the knee replacement. The next exercise, also done standing behind a chair, kitchen counter, any stable surface, is I want to work on bending the knee so that I'm bringing my heel up toward my backside. Now, what typically happens is patients have a tendency to want to flex the hip as they bend the knee, but in this specific exercise, we want to keep the knee straight. We want to keep the knee in line with the other knee and the hip extended. So I'm bringing my heel back more than I'm flexing and bringing my heel up. It's a different exercise to do this compared to doing this. We want to do both, but in this example, we want to work the hamstring, the glute for hip extension, and we want to bring that heel up behind us. We would repeat this 20 to 30 times, 3 to 4 times a day. And then, of course, the final exercise, my favorite exercise, passive knee extension. So all I'm doing is I'm propping my surgical knee so that my foot is on another chair in front of me, or I can put it up along the side of the bed or the side of the couch. It should sit without any support under the knee, but I also want to try and keep my foot as straight as possible. Many of my patients have a tendency to let that foot turn out because of hip tightness and other issues going on, maybe some spinal stenosis. That foot needs to stay as relatively straight as possible. So sometimes what I do is I recommend getting a chair that has an armrest, so that the armrest will support the foot, but I want to be mindful that I don't put too much torque on the knee. So we always want to find a compromise so that we can adapt to our current level. There are some people that are very fit, very flexible. It's easy for them to do this. There are other people that struggle a little bit more. We always want to find something that's right for you at the level you're at. So in this case, I prop my heel, I leave my leg unsupported. I would spend 5 to 10 minutes in this position. If it gets too uncomfortable, I could always bring the chair in. So now I've got support under the calf. I've got my foot resting on the backrest of the chair in front of me. But if I can tolerate it and it doesn't dramatically increase my level of pain, I want to be in this position, nothing supporting the knee so that the knee can sit in full extension. In some cases, I've also had patients that were able to cross their legs, so their non-surgical leg is on top of their surgical leg. They would sit in this position to watch TV, check their email, do things that takes their mind away from the discomfort, but allows them to spend time in this low intensity, long duration mobilization. So I hope these exercise demonstrations were helpful. If they were, please leave a comment down below. If you'd like to see other exercises demonstrated, absolutely let me know. I'll share a link to the PDF file that show you what these exercises are and give you some typed out instructions. And I really would appreciate it if you got value from this. Please subscribe to the channel. My name's Tony Maritato. I'm a licensed physical therapist, and I'll see you on the next video.